Do you think it's bringing what's in C and try to add it to the BCLC-B, i.e. adding the checkpoint inhibitors to the TACE? Or should we think it the other way around, where because of those nice responses to the primary tumor, borrow the TACE and bring it to BCLC-C, give the checkpoint inhibitors, and add the TACE to the local disease?
Yeah, it's a very good question. And I think, I mean, we have seen the launch study before, right, where TACE has been added to lenvatinib, and we have seen actually an improvement in PFS and overall survival. So maybe we really need to see it the other way around, that the cornerstone of our treatment is systemic, right? And we need to decide to whom do we add local therapies, not only in advanced, but also in intermediate stage. I think the HCC ABC study will help to answer this question a little bit, comparing atezo-bev versus TACE, right? Not the combination. At this point, I'm still divided, right? So I think the intent of treatment is for me still important for the combination. In very advanced patients, I prefer definitely systemic. If you have a single nodule, 5 centimeter clear feeder, I don't mind to good liver function. I don't mind to give a shot of TACE, see how he responds. I mean, sometimes we do see complete responses right after 1 or 2 TACE treatments. So I think before I switch also in the early intermediate to systemic, I wait for the comparative studies.
Sure, sure. Laura, your thoughts on that part? I know you smiled at it. I love it, but what are the tastes to the systemic therapy?
Well, I think, I think it's interesting. I still I haven't quite incorporated that into practice, unless of course you have, we've all seen the pictures. All liver cancer distributions are not the same, and so there are patients for whom that makes a lot of sense. And as to the point you made, Ghassan, these patients are now living 4, 5 years, and so things change over time. And I took 2 patients to tumor board and showed them off today because we were considering, a resection after 2.5 years with outstanding response that never would have happened before. So I think in the early intermediate stage, I'm definitely not ready to jump to systemic therapy for all partnered with TACE. I think there's, sparing patients the toxicity and the exposure to it is very helpful. But these patients are a wide array, and I'm so glad we have so many tools to individualize their therapy and keep them alive so much longer.